So let's talk about syphilis. Syphilis is a bacterial infection, and like chlamydia and gonorrhea, all bacterial infections are curable. Now, syphilis is complicated. It has 3 different stages of its infection. The first stage is usually a painless sore. It usually occurs in the genital area. It doesn't look pretty, but it is painless. If it's ignored, that will go away. And there's an asymptomatic phase that if syphilis isn't treated and cured, then it can go on to the second stage. The second stage is usually associated with a rash. That rash can be full body or it can be different parts of the body. But one of the key distinctions of the syphilis rash is that it includes the palms and soles. You can ignore that and then it will go into another asymptomatic phase. And if you don't get cured and treated during that time, it can go on to the third phase. And that third phase infects your brain. And we call that usually an encephalitis, which is inflammation of the brain in general. Let's talk about syphilis in women. Women can have the same symptoms, go through the same stages. If they're not treated, and particularly if they're pregnant, we worry about them most because women can pass it on to their babies. And we don't want babies to be born with congenital syphilis. So let's talk about treatment. So treatment is really sort of dependent on where we catch the infection. So if we catch it in the first stage, in the first asymptomatic phase, and in the second stage, you get treated with 1 dose of a long-acting penicillin. If you can catch it in that period of time between the second stage and the third stage where it's asymptomatic, you actually need to get 3 long-acting penicillin shots once a week for 3 weeks. And if we don't catch that infection until it infects the brain, unfortunately, you have to get admitted into the hospital and get IV antibiotics and sort of get followed up to get the cure. How do you prevent syphilis? One is making sure you don't have it, making sure your partner doesn't have it, using condoms. And again, DoxyPEP, which is doxycycline post-exposure prophylaxis within 72 hours after having unprotected sex, will decrease the chance of getting any of the bacterial infections, chlamydia, gonorrhea, and syphilis, up to 60% of the time.